All right. Good afternoon, everybody. Thank you so much for coming to our new seminar today. I'm so excited that the Center for Adolescent Health is hosting today. And our speaker today is Dr. Robin Stevens. And I was pulling up this bio and it is not working for me.
What about it?
Can I see your computer just for a second? It didn't download. Thank you. Awesome. All right, here we go. All right, so I'll give a brief introduction and then we will turn it over to you, Dr. Stevens, okay? So Dr. Stevens is a health communication scholar focused on achieving health equity in African American and Latinx communities in the United States. Dr. Stevens uses digital epidemiology to investigate sexual health, mental health, substance use, the climate crisis, and environmental racism in the context of the digital neighborhood. She uses interdisciplinary, community-engaged approaches to improve the health and well-being of youth of color, leveraging digital technologies, partnering with youth scholars. Her work has been supported by the National Institutes of Health, RWJ, and Meta. That's cool. I want to talk more about that. So Dr. Stevens is an associate professor of communication at Annenberg School of Communication at USC and the director of the Health Equity and Media Lab there. She received her AB from Harvard and PhD from University of Michigan, go Blue, and her PhD from Annenberg School for Communications in University of Pennsylvania. She is a fellow at the Critical Race and Digital Studies Working Group and a proud Philadelphian. So without further ado, Dr. Stevens, welcome and thank you.
Hi, everyone. That's my favorite part of my bio is whenever I say, oh yeah, I'm a proud Philadelphian. I don't know why. It's something about us. We just love it so much. So thank you so much for inviting me today. I wish I could be there in person. I do love Hopkins. I do love Baltimore. And, you know, you're like a sister city to me. And I hope it's 70 degrees like it is here in California, though.
It is not.
Oh, sorry. I'll come visit in the spring. But I am going to hopefully share with you a little bit about how my work has evolved to engage youth more and more. I've always done adolescent health research, but really the nuts and bolts of trying to integrate young people into the work and moving from being like a community informed to really truly community engaged, in some ways community driven. And who is my community? How has that evolved? I would love, I mean, I know this is, you are largely a room of experts, so I don't want to, just, if you want to ask questions about how it got done or like specifics where practitioner, I'm happy to share that. So I might not be able to monitor the chat, but if someone can and just say, hey, question in the chat, I would appreciate it. Because I would like it to be, thank you. I like it to be useful to y'all, not just like blah, 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 blah. Okay. So also like I am running on just vibes right now because one of my studies is active. So I'll just give you a picture of my office so you can see like I have nothing but sour candy and juice boxes over there. Because teenagers apparently run on sour candy. I don't understand it. All right, I'm going to share my screen. We'll get started. And feel free to ask questions, please. I love questions or share insights. I'd love to learn how I could do some things better. Okay, so there she is. Okay, a little about me. This is our lab in USC. Actually, I started this at University of Penn, where I was for, I think, 5 years before I came here. And one of the biggest challenges, so some of the work I'll present to you, I did in Philly, some of it I did here in Cali, but one of the biggest challenge I will say upfront for me in the last 5 years, because I moved here during the pandemic when it started, is being a Philadelphian and doing community engaged research was so much easier. And I didn't realize that I could just call the people I went to middle school with because they were principals and they worked at the school board and they ran nonprofits. So I didn't have to build the level of trust in Philly because these were already my people. And so coming to California has been humbling in many ways. One, because I don't know the city, which I think makes me it can make me have fewer blind spots because I really am walking around like, I don't know, I don't know, I don't know, I don't know anything. Streets are. But also I've had to like try to get people to believe and trust and want to part with me from jump in a city that's used to a lot of transplants and turnover. So it's been an interesting journey, sometimes extremely frustrating. I've had to do different ways, so I'm happy to talk about that. Okay, boo. So where did this begin? My area of expertise is health communication. That's what I do all day, all night. I start my dissertation was about newspapers. Like that's how long I've been working in media and communication and health. I know like the ones you fold. I know it's crazy. And now I'm doing nobody even knows what I'm talking about when I talk about newspapers. So, but where it started is I've always known I was a public health person from the beginning. I wanted to work and really address racialized health disparities. But sometimes we get it very wrong in public health. And sometimes our messaging, particularly when we're trying to talk about disparities, can go completely all left and actually stigmatize and marginalize the communities that we care so much about. So this is an article from AJPH, but I think it really highlights like the challenge of being a Black woman working on Black health issues, but feeling like ultimately in every class I would take, my community would have either the highest bar or the lowest bar. And so I constantly felt like we were broken, like we were a problem. Every research article I read started with, this is the problem with Black people. This is the problem with you. And so I feel that cumulative burden of trying to, say, hey, we need to focus on this, but ultimately it's really stigmatizing. And I would hear it reflected back to me by the different populations I worked in. People would say like, I know I'm gonna get HIV anyway, because of the messaging around population burdens. So that's one thing I carried. And being a little bit, move forward, little, this is my computer. But I'm not the first person to face this. We can go back to W.E.B. Du Bois in his seminal text, Souls of Black Folks. And even I think Ta-Nehisi Coates brings this more, he engages with this question as well in his Between the World and Me. But I remember reading this in undergrad, and this quote, it jumped out from 1903 and hit me in the heart. And between me and the other world, there is ever an unasked question. To the real question, what does it feel like to be a problem? And that is the burden that I seek to work away from. So we have problems that need to be addressed, but the people are not the problem. The systems are the problem. The structures are the problem. But somehow the message is become across so many disease areas that it feels like it's a people problem. So how do we get past that? How do we sort of shift that dominant framing that occurs on purpose or unintentionally in public health by problematizing people? And so in this lab, I'll tell you a little bit of my journey of how I try to do that. Do I always succeed? No, I still have to publish papers, but I'm trying to do it in a different way. So our goal is to generate evidence. Like at the end of the day, I feel like it's still important to be pretty rigorous in the work. Particularly because we use methods that integrate community and Black and Latino teens, and automatically that may sort of downgrade your work. I mean, not downgrade it, but it's not looked at as the same sometimes. I get a bit of pushback. So we try to be rigorous so that we can stand up to the critics, but really focus work on being action oriented. So doing things for a purpose and centering community engagement. Oh, I talk too much. But also, we want to imagine. So in the work I do with my kids, they're not kids, but they're not my kids, the kids. And I'm speaking of high school students, college students. We have community members. We have postdocs. Like we bring all kinds of people, and all kinds of people have traveled through this space. But we really try to help them not focus just on the way it is, but imagining the way it could be. Right. So pulling out Octavia Butler and pushing them into some Afrofuturist, sometimes just activities like, what could this look like? What future do we want to build for? Not just what do we want to fix? And it's fun. So I just put this slide up here to remind us that a variety of disciplines have named similar or related types of research approaches. And so if you hear me say youth participatory action, it's very similar to CBPR. Community engaged is a light version of CBPR. Because I work in communication and I often end up in the digital space, we talk about co-design and human-centered work. So they're not all the same, but they are in the same family. And there's a long history of doing this work starting, I'm clearly before 1940, but this is when we named action research. Okay, so I started my first study in Camden, New Jersey, which is right next to Philly. It was once the murder capital of the United States, but not anymore. And so but to say it is, it's a lot going on in Camden, but I also met amazing community partners there and work with a lot of organizations that are doing some dope things. But this is when I got pulled into the digital space. So this was back in 2000. I mean, this is when teenagers were still on Facebook. So when was that? 2009, right? That's a long time ago. So this work will reference Facebook. But one thing I started noting from working with young people, we did interviews, we did focus groups, we had in-depth interviews, focus groups. We did volunteer training, like would go in and push into spaces, do events with them. And we did one more thing, surveys. And one thing that was clear, and this is probably old news then, but at the time I started seeing from my teens that their digital activities were full of health-related things. So we're seeing tons of sex-related content, conversation, discourse, risky, unrisky, violence-related, community violence exposure, substance use, alcohol, like everything that was playing out already in adolescent research was happening in the digital. And this is a time when people, if you put social media in your grant, people are like, oh, that's so sweet. Why would you want to study that? But really, I found, and I argue that that young people were existing in their own digital neighborhoods. And even though we were all using the similar platforms or many similar platforms, everyone's digital neighborhood had different content, just like all of our real physical neighborhoods. So I made this concept to try to get really public health folks to embrace the fact that we had this third space that was influencing adolescent lives. Now, this is probably a pointless argument, but then it was new. So I'm still proud of it, even if it's old. Okay, so these are some of the things we did in this space to bring the youth into it so they weren't just the domains of the people we were studying. We hired a youth expert research team. So we hired teens from Philadelphia, which is not in Camden. Most teens from Camden, Philadelphia at the time didn't share high schools, they didn't cross. So it was not the same social network. So we hired expert teens. We had teens in our studies they gave us their social media data to review. So we used computerized retrieval and manual content analysis. We tried to use things like MTurk, like we tried all kinds of different methods to try to understand the discourse that young people were having in their digital neighborhoods. So from 50 kids, we ended up with 500,000 words. This is so much fun. And what would happen is yes, the computer can like retrieve keywords, and we did a lot of work with that. But once we get the text that people were sending, I couldn't necessarily understand what they were talking about. And that's when I realized I was no longer young. So, would you like to know what we learned from this study? One, we saw a lot of modeling behavior and norm establishment and reinforcement around different health behaviors from teens' posts on these sites and comments. We also found that the young people, and this is really encouraging, the young people who were using condoms at last sexual intercourse, they were getting information. Top two sources were word of mouth and social media. So our youth who were doing the most protective work sexually related to condoms were also heavy they were getting their info for social media, which means that there's an opportunity space for us. We also found that youth were so strategic. So they were seeing tons of content related to sex, nudity. The farthest bar to the left is what they saw, and the smallest bar, the black bar, is what they posted themselves. And each level is a level of engagement. So we see this is what they're exposed to. The next bar is what they actually engage with a like. This is posting by someone else, seeing locally, posting by self, right? So we created this, we call it the social media engagement continuum. So young people see a lot of stuff on social media, but that doesn't mean that they are they're strategic about what they post themselves and how they engage with it. And we really saw it across behaviors or across content areas, this cascade. We also got we pulled direct quotes from young people. These are de-identified, so you can't back search them. But this is the kind of thing that we were finding. Y'all don't know about your partner health. They can tell you anything, and it's your choice to believe them or encourage them to get checked before they touch you. There's a lot of clinics that test for STDs for people with no insurance. Take care of yourselves, because if you won't, ain't nobody else going to. Right here, did you expect us to find people telling other people about health insurance and going to get tested? This is not the narrative you get about inner city Black youth, is that they're sharing healthcare access information with each other, right? And I love it. I love it. I love when we're underestimated. Here's another one. Ladies, safe sex is the best sex. Well, shoot, you should come work for the public health department. There it is. You better make him wear latex. These ninjas ain't what they seem to be. Trust me, I experienced this for the second time. See, we have anecdotal experience. These are outcome expectancies right here. Always strap up, unless you're going to be with him and you know he's going to be by your side through it all. But do you really know? Because they play. And here's the neuroscience. Their brains ain't mature enough like us. May God forgive them what I'm about to do. We have like a lot of discussion about what does the last line mean. And honestly, it's unknowable, but if anyone thinks they know what it means, or if this is their post, please tell me what you were talking about. Some people think she's about to get an abortion. Some people think somebody's about to get beat up. It's unclear. And also I had to like put in my review, my articles, like people type differently on social media than their literacy level. So don't assume that this person is low literacy because of the way they type on social media, because even that wasn't clear to reviewers. Okay, and this is my other thing, and this goes back to the quote I showed you from Du Bois about being a problem. I see it's a lot of us going to college. This is on Facebook, so it was for her network. That's what's up, because everybody thought our generation wasn't about shit. We were only good for making babies and smoking weed and killing each other. Keep it up, everybody. F what other people say. So this is her taking the stigma, flipping it and saying, you know what, social media gives us a chance to show who we really are and what's going on in our community. And I love that for us. And so there, at the time that we wrote that we published this, there was all these critiques of social media addiction and bullying, but no one was talking about this side, right? The voice that it was giving marginalized youth, the community it was building. There are, I also have negatives, but there were absolutely positives. So that first study, we had youth help us code and read and analyze the Facebook posts. So the takeaway from some of that is social media was great at giving us near real-time insights about people in group conversations, right? Because people are talking back and forth. So we get to watch discourse. They reveal health cognitions and behaviors. We can look for new and emerging trends. I hate the word surveillance, but here we are. Its actual use as its own behavior to be studied, and you can use it as a recruitment tool and an intervention site. But we also learn a lot of problems in doing this work in the Wild West of online. There's tons of performative posting. You're typically retrofitting data because you don't get to choose it. You must have community experts at the table. I don't care. I'm sorry if you're in this room and you can be mad at me later, but I've read too many articles where people use large language models that have been built on college students in Iowa to try to understand other communities without any expertise. And I've seen it go really wrong. But because it's a lot of data, people think it's accurate. So big data automated computational processing has real limits. But because the data is big, people don't think the limits are big. Predicting user identity is difficult. So it's hard to know if the race, the ethnicity, if my people are youth, if they're real sometimes without enrolling them in the front end. And you have to work with platforms. So I have been shut down and been in Twitter jail multiple times for my Twitter study. Even though it was approved, platforms change their protocols as we've seen. So you can really have a monkey wrench thrown into your research because they have business models that aren't research models. Also, digital technology is not made, none of it is made to help people. I'm sorry, it's true. It's made to make money. And in that way, digital technologies often reinforce health inequalities in ways that harm Black and Latino youth and communities. And so because we have to be knowledgeable as public health people of the digital harms that exist, because our young people are in it. They're in it more than they're outside of it, right? And the people who are building the tech are not necessarily in conversation with us. All right, so I do have a few papers where we try to look at the ethics of using computational methods without reinforcing racism, sexism, and bias. If you're interested in those, but most of those are really published and in communication in journals that are comp sci facing, less so in public health facing work. So it's weird because you're like, either you're talking to the computer scientists or you're talking to public health people, but really there's not a lot of spaces that are integrated. So that's sort of what I'm trying, I'll have to keep going. Ooh, I feel like I'm talking a lot. Any questions? I'm gonna take a drink of tea.
I had a quick question, Robin. So you said you started this work when, a lot of people were on Facebook pre-pandemic. Given the rise in social media and other social networking sites, do you think if you did the same study now that you'd find similar results?
Yes.
Like I think about like how young people are just posting on all the things on Instagram. They just post a lot more, I think, than folks did earlier in the 2000s.
Yes, because the platform, we call them platform affordances, and basically it's what the platform allows young people to do. It doesn't really matter what platform it is. And so the best thing about teenagers is that generation is going to make the tech work the way they want it to work, regardless of the way it was intended to work. So whether it's Facebook, I think that study's from 2011. That's like 11 years ago. They were on Facebook. Or Instagram. I mean, we even had Vine in one study, and that's dead. We did Twitter work for like 4 years, and that's over. Now we're much more Instagram and TikTok, but we don't really care about the platform. We just go to the digital neighborhoods youth are in. I know people who work more with the Twitch and YouTube. I haven't done YouTube is huge, but my gosh, it feels a little less social and more social in different ways. So you have to be nimble to just evolve and know that the other part about it is, so let's say everyone's on Instagram, middle schoolers use it a different way than high schoolers, and high schoolers use it a different way than college. And so you can't everyone, if you just do a study of use, will say they use, but the use is very different depending on sort of those very micro age segments. If you talk to your cultures, they're like, I remember when I used to be, and they're like, I would never, or I only use this to find activities, or this is only for messaging, or this is for my brand. Like, it's very interesting, but the platforms are always going to evolve, but the behaviors and the affordances will remain. So just keep on asking teenagers what they're doing. Okay, more questions? That was great. Thank you. Stacy, hi.
Hi, this is really fascinating. Thank you for being here to speak with us. I have, I guess, kind of two questions. So one question is, are there any differences between the types of teenagers who are using the different platforms? And then I guess a follow-up to that maybe is more a comment, but I'm curious about the history or the lore that is attached to each of these different platforms, and thinking specifically about the neurodivergent community is one that I am in. And so I know that like Discord and Reddit are really big and have historically been really big. So yes, I guess both my questions are pretty similar, and just wondering about any differences in who is.
These are micro communities. So they absolutely, they not only differ, but they differ over time and by age group, right? And so I think what your point points to is if you are doing work in this area with teens, you have to ask them where they are. And it's not a one size fits all. And it definitely has a time limit. But we have to do the work to figure out what people's digital neighborhoods look like. We can't assume just based on demographics, because even geography makes a difference. Like over here in Cali, we have a ton more folks on WhatsApp because they're communicating with people in other countries, right? And they have family members in other countries, and WhatsApp is a quick and easy way to do that. But also there's content, there's socials. I mean, it's still a social media site. So, I mean, it's within Meta, but anyway, I think the point is you can't start this research without first asking your community where they are, and also finding out sort of the ethics, because some particular communities, like there was this big, really dust up where someone sort of was a researcher lurking in a mental health related, suicide related group. And though they de-identified the information when they published it, everyone from that group could identify it because it was a small group, right? And it was outrage. So we ethically, and the IRB won't catch it because it's public, but ethically we have to be responsible. Zayu, did I pronounce that correctly?
Yeah.
Okay.
Thank you. I have a quick question about, I'm interested in the statement that you said the digital technology will reinforce the inequity. Can you give me an example to help me to understand how digital technology or social media will reinforce such inequity? Is that because like people with vulnerable SES, they will have less access to social media, or like, yeah, can you help me to, yeah, thank you.
Yeah. So there's so many examples of ways that digital tech, and it's not just social media, think more broadly. So we can look at digital technology as algorithms. So we see race is often a predictive characteristic in algorithms related to clinical algorithms, predictive policing, I'm trying to think of the word, sorry, it happens, my brain declines. Sentencing, even foster care, resource allocation, surveillance, that I have been in many rooms where based on when race is, because algorithms use race in the front, they use the past, which has racial bias in it, to predict the future, it reproduces a racial bias. So whether it's in, you know, a clinical algorithm of when somebody deserves to get a transplant, or how long a sentence, how likely a person is to be recidivist, if race is baked in, it automatically is going to reproduce that bias, and people don't necessarily know it's there, but they assume it's correct. In socials, we see, like, for instance, when I was working in Camden, it was a lot of physical, like community level violence. And so young people, young people had to be very careful on social media so that the violence wouldn't spill over. So things like checking into sites and letting people know locations. This is older, things have changed now. These weren't protections that necessarily the platforms put in. So without platform protections around checking in, or people would be lured into fights, like through locations on social media, but that wasn't really a priority. And that primarily was happening in communities that already had higher levels of violence. Those are just two. You could also think about like digital technologies that are self-driving cars that don't recognize people when they have melanin in their skin, and then they run over them and kill them. So there's like a lot of ways that even hand sanitizer, I mean, the automatic hand machines, you can put your hand under, and if your skin is too dark, it doesn't reflect, and you don't get to get soap. All right, Farah.
Thank you so much, Robin. This has been an incredible talk so far. And I love this idea that, you know, what folks expect social media, its impact to be on kids, it might not necessarily be that way in all cases. That's always been a feeling I've had, because there's such a disproportionate focus on the negatives, on cyberbullying, on what we as adults who are not digital natives, who are not born into this technology, assume young people get out of it. And I recognize there are challenges, obviously, that come with it, but it was really cool to hear some of the work that you've done. And I was interested in hearing your thoughts around, you know, young people's engagement with social justice and activism, and that how it intersects with social media, because I feel like for a lot of young people, social media gives them a voice in a way that they may not have in the IRL world. And so, and it also gives them a way to mobilize and get together around causes that they believe in. And we've seen, I think a lot of folks have talked about some of the, again, the challenges that could pose when you have, say, you know, police killings in your pocket that you could watch at any given moment. But a positive side of that is that it allows people to mobilize and to really, you know, come together around a cause. So I'd be interested to hear what your thoughts are around that space, if there's been any work that's looked at that in relation to health, maybe mental health or something along those lines.
I think you've like said it. You made the point. That is absolutely one of the benefits. We also see community building, right? There's a huge benefit for people who maybe are one of only one in their neighborhood, but now they can find their people, which is so helpful for belonging for young people. I can send you some people whose research is in activism on Twitter. I'm thinking like Sarah Jackson, but you've made the point. It is a space of voice amplification that we did not have, and of organizing, and also education. Like, if you talk to teens now, I mean, I don't talk to all teens, and I guess it depends on what silos they're in and what versions of social media they get to see, but many of them are very aware of things that they may have only had their parents' opinions about previously. Asia or Aja?
Yes, you got it right. I'm Aja. Hello.
Aja.
This has been such a great talk, so thank you. My question was around, you spoke a little bit earlier about perceptions of what certain communities might include on their social media use, and how some of the things are actually great things that should be harnessed or could be utilized for the better of communities where they get their health information from. And I remember a couple of weeks ago, Facebook had gotten in trouble, for lack of a better term, for not making sure that they were putting protections for some of the negative things that younger people are seeing when being exposed to social media. So I'm just wondering, from your perspective, as someone who does social media, what people who are early researchers, or what even younger people that you're working with, have to say about some of the things that are negative that could be addressed via the platform, to make sure that while youth have all of these benefits of being exposed to different things, being able to create community, being able to share health information, enforce positive norms in their community, how can they also experience the protection that we say that, you know, young people deserve as they grow up and show up in this neighborhood?
That's a great question. And it's very real, because as many positives we can point out, like we all know, there's a flood of mess, right? That young people should not have to necessarily, it's a flood of mess for adults to engage with. And so young people have multiple levels, right? So they have interpersonal challenges that happen on social media, but then there's also problems on the platform that expose them to things. Like they're going to see more porn than they're going to see sexual health. I mean, porn sales, like not just like, oh, look, I'm naked, but like people actively marketing pornography to children. Then they're going to see sexual health messaging, right? Let's just be honest. So how do we deal with that? One, this is absolutely a policy issue. This is not, so we can, we're very good at like helping individuals navigate and teaching people skills and building self-efficacy, but the way the platforms are built without accountability and oversight, for the purpose of just constantly making money and pulling data and keeping this, like, you think about it, if TikTok is about being sticky, right? So every single time, they could absolutely make the platform stop at a certain hour, or make it so boring after an hour of scrolling that you quit. But that's not what it is, right? That's not how they build it, because that's against their business model. But that's why I think it needs to be regulatory oversight. So I think that's what part of this lawsuit is about. If you look to people in the European Union, they're like 5 years ahead of us, and they want to know, why don't we think we have the power to govern these organizations that have so much access to all of our population and have been shown to do like some dastardly things. So I don't know if Facebook is going to lose this lawsuit. I do also have a grant with Facebook, but I'll talk about that. If you want, I can just jump to that. But it's clear that their priority is not teen and youth safety. They do have people there, but to be fair, not to be fair to Mark Zuckerberg, I'm saying corporately, that's not it. They absolutely have teams that work on youth safety, and everyone who I've met on that team is committed and serious. However, it seems like from the whistleblower documents that they like come up with great ideas, and they're like, this is what we can do. We can add this, but it doesn't go beyond them. Their great ideas are moved off the table. So that's why I think it requires regulation on a federal level. Okay.
Thank you.
Thank you. I'm going to skip, because of time, this is like a study I did on Twitter, blah, blah, blah. It's already published. You can send it. But okay, this is what I'm doing now, right? I want to turn this on its head. I don't want to focus on problems anymore. I only want to focus on solutions. And the same people who are the problem people, to me, this is how I visualize it now, are the solution people. So my work is about getting the solution people the access, the training they need to build solutions. It's too late for me, right? I'm old now. So all of my dreams I put into the young people who come into the lab. And no longer, I used to do my work, I was centering youth voices, like amplifying them, making what was unseen seen. Now, bunk that. I just want to train these kids, get them connected, and let them cook and see what will happen, because they're so eager, their brains are still tight, and they're like ready to go. So how have we done this practically? So I moved here during the pandemic. It was horrible to run community research in a pandemic with teenagers, but we somehow did 2 studies online. One was LA Futures, one was a teenage program. Both studies were implemented with grad students and undergrads. And we partnered with Compton Unified, LAUSD. So I had to go with schools. I couldn't build community partnerships well, but I was able to get I found a lot, and I couldn't go through school boards, okay? Like Los Angeles School Board, you have to submit all kinds of work. But what I could do is create programs for young people, and teachers and counselors wanted their kids to do that kind of stuff. So we embedded the research in a larger training program, and that has been working so far. So for these programs, originally we had 4 spaces for one because it was NIH funded. We have 44 applicants. So we had to make a second program called LA Futures that didn't really have a reason, but we couldn't turn away that many kids. And so they did like a summer scholars program. These were the 3 areas: mental health, substance use, sports and energy drinks were funded by NIH. And we did, it was not a camp, but it was like sort of over the summer, they would receive training. They would do research exercises. They would receive training. We do research exercises. We've had young people do content analysis, neighborhood observation. We'll be doing interviews, teaching them interviewing this year. I've had young people run focus groups, analyzing focus groups. What else? What else have I had them do? I've had them do statistical analysis. I've had them do message creation and message testing. But it's not just like we train them on the skills and then we tell them what we need, and then they make stuff. And some things work better than others. So for the teenage project, we really had this issue around drinking sports drinks and energy drinks. It's this weird like area of health where these sports drinks and energy drinks, particularly sports drinks, have really high sugar content, but people think they're good for you. So it's like a unique health challenge where most people, your coaches, your parents will tell you to drink it, but actually it's really high in sugar. This was sort of a proof of, could we do message creation with teens? So the study included a content analysis of advertised messages, surveys of youth cognitions and behaviors. We did focus groups, a national survey, and then we did the message design part, and that's the part that I led, and that's where we had our summer scholars come in. So, but first, this was important. If we didn't do that early research, that early focus groups, and the focus groups I did with community partners, and that was great. What we learned from that I had already built relationships with. So getting youth was really easy, but we didn't include coffee in our first understanding of energy drinks. We were thinking Monster and Bing, I don't know. And all the kids were like, oh, coffee. And guess what coffee is? So is tea, an energy drink, right? And it's also filled with sugar. So if you're from Philly, I don't know about y'all, but we had Wawa. So Wawa is this like convenience store that has all kinds of delicious drinks for really cheap, and they're by schools, right? So, and Dunkin' Donuts. So like our #1 drink was coffee related, but they were always like, hazelnut, blah, 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 blah. It wasn't just like black coffee. It was like sugary, delicious coffee. We also learned that like people would have would drink coffee with their grandparents. Like it was a moment. So they couldn't even see walking away from it. Okay, blah, blah, blah. I want to move on. So we did a 5-week virtual camp thing. We didn't call it camp because they're teens. Ooh. And they received $750. I have a rule I call the Chipotle rule. I always pay my youth more than Chipotle pays them. That is the rule. It has been a challenge dealing with the university and payment, but that's a whole nother talk we can talk about. It's been a nightmare. But I'm going to pay them well, and I'm going to pay for transportation, and I'm always going to feed you because I'm going to treat you the same way I treat my undergraduates, right? And I'm going to bring you to the university, and I'm going to get you an ID, and I'm going to make you take up space in this place, right? This is yours now. Walk around, be loud. I don't care. Like, you belong here. That's a very important part for me. It's not a privilege for you to be here, right? We're doing this together. Okay, let me get to, okay, so they made 19 distinct TikTok videos and single and multi-panel Instagram posts. Now, mind you, these were not like designers. So the first round is just them like working with PowerPoint. They learned they learned the toolbox of persuasive messages, they learned content, and then they start making messages. Some of them had lies in them. So we had to like change them because they were like, can't really say that, science is like we have to like qualify it. And then what we did is we gave these messages to we found young Black graphic designers to amp them up, not the TikToks, but the messages. So we had teens working in the message design. We had young adult graphic designers from the same community. And so they amped up the messages, we cleaned them up. And then we had a second group of teens review them later in the year and do focus groups around which ones worked, which ones didn't. One thing like this, the teens love to give us pictures of people's teeth. The message testers hate it. They're like, nobody wants to see teeth. It's ineffective. So we had to scrap teeth, like teeth were our biggest, like, this is your big harm is teeth. Okay. We had this using the memes. I think this is 4 years old, right? And so they used popular memes at the time. And even we learned that you could use memes that aren't popular because they're retro. Oh, yeah. I'm gonna scroll through. Okay, let's see. I don't know if this is gonna work because I disabled my TikTok because it was really wasting too much of my time, but we'll see. Yeah, sorry. Oh, continue as guest. Okay. Where are the videos? So yeah, I don't think it's gonna work. Maybe. Okay, I like this one.
When you find out energy in sports drinks actually cause harm to the human body.
Can you hear it?
When you find out energy.
So they had a lot of fun making these, and actually, the sports and energy drinks, these tested, like teens love these, even though they were like messy and not curated. Okay, this is very long. Let's see.
You made me laugh and I was losing it. 'Cause you are the reason I'm still hanging on. You are the reason why my heart is still above water. I give the moon. Maybe to you, and wish that was coming to you. I give my life on you. 'Cause you are the reason why I'm still hanging on. And you are the reason why my heart is still
Sorry. The thing about teenagers, y'all, they go so hard. Like they're like, you drink this coffee and you will die. So we did have to add, we didn't use that one, but we did have to add a level of accuracy check. after their messages.
Yeah.
Some of it, we were like, this is not true. Yeah, accuracy and acceptability, diverse designers. And so these are some of our finals. So we got teeth, but we didn't show real teeth. They like it to be aesthetically pleasing, but TikToks can be more informal. And then I'm just gonna scroll ahead. Oh, yeah, this one they liked. I don't know. I still, it's not that funny to me, but I'm so old, it's okay. This one was also pretty popular. People liked it. And I don't always understand this, but sometimes I do. But maybe you do. If you understand any of these, you are 25 and under. So bottom line, youth can create messages, they can do high level digital design, and we got they can make TikToks that are probably need to be edited, but they can make TikToks that they understand each other. Like, so the youth who made them, created them, I saw them, I didn't understand them. A whole separate group of youth were like, oh yeah, that makes sense, I like it. So I can see there's like this language thing that I miss. We have so far of those who graduated, one is at a UC college and one's at Harvard now, and then 2 work as graphic designers as well. Like they have side hustles, so that's really great. And two or three have come back to do other programs with us. And so this is the last one. Oh my goodness, I talked so much. This is the last one. Oh, real quick, it's my only slide. Right now I'm in the midst of a project with Instagram. This came out of working with Instagram's Wellness Collective, where I just basically trained creators on how to talk about mental health on their platforms. And that was like a 6-month pilot project with them. And then I met some people, I told them what we do. And then we are now in the midst of the first Instagram co-design lab with USC, where we have 14 teenagers from 7 LA USD school, Black and Latino high school students who are working with Instagram product designers on 3 topics to make the platform more supportive for teens. And it's not a focus group. They are getting trained on the software, they are getting devices, they are learning prototyping, and they are working with the designers in sort of design sessions over a weekend to try to actually influence what is going to be rolled out really in the product and what will work and won't work. I don't know if this is going to work. I'll let you know in May, but I know if nothing else, the young people will have access to what we call secret white people jobs. These are jobs we don't know exist. And now they will get to know they exist, know the people who work in them, and they ask the questions about how do I get to these secret white people jobs, which is really the whole point. I'm just joking. Okay, that was a lot for me. I have a lot of people to thank, and I also want to call out one of my amazing research assistants, who's now your doctoral student, Alexis Phillips. So if you see her, give her a big heart for me. She's amazing. Okay, that's it. That's all.
Thank you. If you are online and have a question, or in the room and have a question, feel free to add it in the chat box or come off mute and ask Dr. Stevens whatever any questions you have.
Ooh.
I have another one, Robin. So I think that I've encountered an increasing number of students interested in this intersection of social media and health. How might our students be able to connect with you or work on some of the exciting things you're doing with social media and health?
Oh, well, you could come to sunny Cali. No. So some of the people who have been on our research teams aren't here. So we've had people like it's more during the pandemic, but we've had students who just joined us remotely for our meetings. I think the best way is, I don't know. That's a great question. I don't know. Like, we're not a closed lab. So anybody who comes is a part of us forever. That's the only problem. You have to get a tattoo and then you're one of us forever. But also one thing I'm thinking more about is how do we incubate new ideas for people?
Yep.
So so people aren't learning from scratch, but bringing like, I'd like to do something like this. Can we talk about it? And if anyone wants to, like, the main thing that stops us from running more programs is funding. So we're always looking for ways to do this and export it, share what we've learned so other people can take it and do it in their own spaces. So definitely open to that.
So don't be surprised if I connect you with some students. There's one in my mind. I'm like, oh, she really would learn a lot in thinking about how you've been able to work with the platforms. I think that seems to be a big challenge for people, figuring out like where to start.
Yeah, also they're not, the
Yeah.
platforms keep themselves kind of closed off. So that is a challenge. And they're so big. And so it's like, who actually works there? It's like, you can't even get a person. So I don't have all the answers. Also, there's more and more people who do this work. So like out of UNC, there's like a whole group of youth adolescent social media researchers. They just hosted a conference. NIH is about to host a conference they asked me to speak in April. So I don't know if it's public, but if it is, I'll send it out. So people, you could at least
Please
see
do.
on that list. Yeah. It's definitely like, you know, a good body of 50 to 100 researchers, not just here, but who work specifically adolescents. A lot of people do mental health and social media.
Any other questions, comments, concerns?
Oh, thanks, Stacy. I don't know who I was up against, but woohoo. Oh, Q Wallace, what's up?
Hi, how are you? Thank you so much for your presentation. It was great. I'm Kiana. Could you talk a little bit about the training required to kind of onboard your youth to the PAR work? How long do you usually take to train them? Or is it more of a learning by doing process?
No, I think it's not. I think it's important to train them in some things because I'm very cognizant of the power imbalance. So I want them to feel empowered, right? So that's part of the training. They don't always like training though. So I actually did my first YPAR study when I was a student at Michigan. I don't know if you know Michigan, but Michigan is CBPR hardcore. Like, so if you're gonna if you're gonna do research, go blue, yes, you better. So I was employed by community-based research organizations to do work that they had designed. Like that was my job. I worked for them, not for the university. Which is really dope. So what I do, like I often have, what I have in here, like we make like training manuals, always probably like the first, depending on what the project is either integrated, so some training time and activity. So like if it's a lot of content, like persuasive messaging, and there's so many different ways to do it, it's better to have them, how do you build fear messaging, or how to use statistical methods, right, for messaging, and then practice doing it rather than do like all the training bunked together. But some of the initial training is stuff around voice and agency. So having them argue, having them do debates, having them create statements, having them speak publicly is like part of the training as well. And then the research training, you can integrate, like learn it, teach it, and then do it. Teach it, then do it. Because they don't want to go to, one thing, they do not want to go to class for hours and hours. They're not going to graduate school for us. I hope that answered your question.
It does. Thank you.
Welcome.
Any other questions, comments, or concerns?
No. Thank you so much, everyone. It's worth it to do this kind of work. So keep up the good work.
Yes, thank you so much, Dr. Stevens. One last round of applause. We appreciate you coming. You'll probably get some emails from me or others, because this is a lot of the work that we do also at the Center for Adolescent Health, trying to like figure out where do we stop and like young people begin. And so it's been really good to hear your evolution, right? Like, hey, at first I like had a lot of control and now youth are leading. So, and learning, and especially, and thank you, Kiana, for asking that question about training. That sometimes is a hard space for us too, because, you know, a lot of us, we've been in school a long time and a lot of years, and figuring out what we didn't know at the beginning is sometimes hard, right? So, yeah, so like if there are other things that you are willing to share, definitely share any resources around the conference that you mentioned, and we'll
Okay.
make sure that folks in the department get that. If it is open and public, and if there are ways, other ways for us to connect, please stay in touch.
I will.
right.
Thank you, everyone.
Thank you so much. Thanks everybody online. Thanks everybody in person, and have a very good rest of your Wednesday.
Bye.